Welcome back. Two Utah doctors have helped put together blood clot treatment guidelines used now around the world. In tonight's Check Your Health report, Mary Nichols explains how these guidelines likely saved the life of a Utah mom.
Then we were talking, and then all of a sudden I passed out.
2 days after giving birth, Arlie Gregerson was in the hospital and passed out.
I couldn't catch my breath. I felt like I had been running a marathon.
Not only could she not breathe, her heart stopped beating. Nurses started CPR, and once they had a pulse, moved her into the ICU.
And in the middle of them transferring me over there, they lost my pulse again. And so one of the nurses that was on the MET team jumped up on the bed and started doing chest compressions again.
It was a blood clot in her lungs that was preventing blood flow to the rest of her body. Fortunately, doctors had clot-dissolving medicine ready and gave it to her right away.
Everything fell into place exactly how it needed to be in order for me to be alive today.
The treatment guidelines that saved Arlie's life were created by a team of 15 physicians from around the world, including 2 doctors at Intermountain Medical Center's thrombosis clinic.
They've really become the Bible of treatment of venous thromboembolism over the years.
The guidelines address key questions, such as using medications called direct oral anticoagulants.
So there's a recommendation to consider using one of those medications as a first-line treatment in patients with blood clots.
Those medications stop existing blood clots from growing or moving throughout the body, but in cases like Arlie's, they don't dissolve existing blood clots.
For the very worst blood clots, when they're life-threatening, sometimes we use medications that actually break apart and dissolve the blood clots.
Mary Nichols for Check Your Health.
These guidelines also include deciding whether or not to treat small blood clots. Both doctors say the best way to prevent blood clots from forming in the first place is by being mobile and active.